Hi, I'm Dr. Gil Welch. In this Less Medicine, More Health short take, we'll consider the spectrum of baseline risk. More importantly, we'll consider how this spectrum influences the balance between benefits and harms. This is relevant to assumption number 2. It's always better to fix the problem. But that's not always true. Sometimes it's better to manage the problem of heart disease with a healthy diet, regular physical activity, and a few good medications than it is to try to fix the problem of heart disease by inserting wires, blowing up balloons, and placing stents. This is known as percutaneous coronary interventions, or PCI. When you think of a spectrum, you probably think of a spectrum of colors. But most medical disorders exist on a spectrum. In cardiovascular disease, at one extreme might be a patient having a heart attack. At the other extreme is a person with abnormal coronary arteries, but nothing else going on. And maybe in between is a patient with chronic stable angina. That's what I mean by the spectrum of baseline risk. It runs from low to high. Now let's consider how the spectrum of baseline risk impacts the net effect of medical intervention. And I want to share with you 4 randomized trials addressing the value of blood pressure control. The outcome here is the annual rate of death or end organ damage. End organ damage is stuff we care about, things like heart attacks, strokes, kidney failure, etc. And I'm going to show you the untreated groups in these 4 trials first. And here's the patients with very mild blood pressure elevations. Here's those with mild blood pressure elevations, moderate, and severe. And as you can see, who's more likely to have end organ damage or to die? Well, someone with really, really high blood pressure. This is the spectrum of baseline risk, from low to high. Now let's show you the treated group, and as you can see, the treated group still experiences some advance, but the benefit of treatment is moving from one bar to the other. The difference between the 2 bars, the so-called absolute risk reduction. There's a lot of data up there, so let's just remove it and look at treatment benefit itself. And maybe this is a long run for a short slide, but who really stands to benefit from treatment? Someone who has really, really high blood pressure. So I'll just generalize this. Treatment benefit increases with the spectrum of baseline risk. This is true of most medical disorders. That's what treatment benefit looks like. Now, it's important to remember all of our interventions pose some harm, so I need to have a treatment harm curve up here. And I'll start by drawing it here, and then, because I must acknowledge we don't know exactly its slope, I'll make it wiggle a little bit. But for my argument to hold, all that's relevant is that the treatment harm curve doesn't have a slope as near as steep as the treatment benefit curve. In other words, treatment harm is more a fixed effect of the intervention. If that's true, there's certainly an area for net benefit. But we also need to be concerned about an area of net harm. Where is it? People who are on the low end of the spectrum of baseline risk. So, what's likely to be up here? Well, blood pressure medications for someone with a systolic blood pressure over 170. Cholesterol lowering in someone who has had a heart attack. Removal of the ovaries in someone with the BRCA1 mutation and a strong family history, someone like Angelina Jolie. And in general, interventions in people who are acutely sick or injured. What's likely to be here? Blood pressure medications for an elderly patient with a systolic pressure under 140. Cholesterol lowering in someone with average cholesterol and average risk. Removal of the ovaries in an average woman. And interventions in people who are well. Let's consider the effect of diagnosis and treatment in patients with symptoms and consider both the benefits and the harms. Patients with symptoms can experience a really big benefit. They can feel better. In addition, we may be able to reduce their chance of future health events. Those are both important benefits. What are the harms? Well, they're physical harms. Medications have side effects. There can be surgical and procedural complications. Then there are the hassle factors, more appointments, phone calls, tests, etc., and more insurance forms to fill out. And then there's more expense. You might not consider this a harm until you realize that medical expenditures are one of the most common cause of bankruptcy in this country. That can't be good for your health. So this is the balance sheet in patients with symptoms. How about in people without symptoms? Well, it's awfully hard to make them feel better. And now there's a new harm to consider, a psychological harm, the idea that something is wrong with me, an increased sense of vulnerability. So let's come back to inserting wires and blowing up balloons. Where does that make sense? Well, it certainly makes sense to do a PCI for a patient having a heart attack. That's where there's likely to be net benefit. Where is there likely to be net harm? PCI for a person with simply abnormal coronary arteries, but nothing else is wrong. Patient like former President George W. Bush. He was an active guy. He felt well. He saw his doctor. He had a PCI. What was interesting is some doctors wrote exactly what they thought about it. Here's an op-ed from the Washington Post. It's worth noting that at least 2 large randomized trials show that stenting these sorts of lesions does not improve survival. Because Mr. Bush had no symptoms, it's impossible that he felt better after these procedures. They went on to say, instead, George W. Bush will have to take 2 blood thinners, aspirin and Plavix, for at least a month and probably a year. While he takes these medications, he will have a higher risk of bleeding complications with no real benefit. The assumption is it's always better to fix the problem. But given the influence of the spectrum of baseline risk, the disturbing truth is that trying to eliminate a problem can be more dangerous than managing one, particularly if you have a no problem problem. I hope this helps. Thanks.